proposed budget study session. Really glad to have all of you here, and thank you for spending some time with us today. The staff is really excited to present this budget. Spent a lot of time really making sure it aligns with our four strategic pillars of great governance and operational excellence, wealth equity, and partnerships.
Before you get too far down, can we, I guess I should,
we should,
do the
kind of
formal meeting.
officially call the meeting to order. So
Yep.
I know this feels a little redundant, but let's just go around and say what board members are here. Sarah Hathcock, Secretary.
John McCabe, PBH liaison.
Julie Field, treasurer.
Oh, I got everybody at a bad time. Sorry.
Vice president.
And Erin Hottenstein, president of the board. And so we do have a quorum, and we will call the meeting to order at 7:18 p.m. And just to note that that our previous meeting ended early, and so this meeting is starting a little bit early. And so from that standpoint, I think it would be a good idea to move the public comment until later in the meeting, in case anybody happens to wander in a little bit later. So before we approve the agenda, I would suggest that we move public comment until like right before adjournment. And so I'm going to make that suggestion. I'm just wondering about, should I read the conflict of interest statement again?
No.
We don't need to do that. Okay, great. All right, so do I have a motion to approve the agenda with the amendment of moving the public comment to before the adjournment?
So moved.
Okay, one second. All right. All those in favor say aye.
Aye.
Any opposed? Passes unanimously. All right, cool. All right, now you
now we can go. Okay.
Ready.
So you'll notice that there is a proposed budget kit here for you that's separate from the agenda. If you want to kind of follow along, I have a little PowerPoint just to kind of cover the verbiage at the beginning, and then we can move into some of the. Well, you'll find that with some of the information that is on the board today doesn't have a lot of detail, so we can refer to the detail in the packet as we go through. So I'm going to see if. Yeah, no worries. It's okay. Oh, okay. So just a reminder, you guys did receive a copy of the draft budget on October 15th. And you'll have 2 more times to look at budget. So we'll do another budget hearing at the November board meeting, and then it will be finalized and adopted in November this year. Okay, let's see if this little magic is going to work. Nope. Can I steal the? Yeah, thank you. Okay. So again, aligning with our four pillars, we want to make sure that we stay consistent with our services that we're providing for oral health, behavioral health for youth and adults, our access to care, insurance enrollment, and our prescription assistance program, our strategic funding partnerships that we've had in the past, and maybe some potential new partnerships. Increasing our community engagement is something that is involved in this budget, as well as really improving our data collection. So that's something that we know in the past has been a little bit of an area of improvement, and we're really going to work on that this year. It's going to be kind of a forefront of the budget, and that will help us make data-driven decisions moving forward. So some pieces that we're going to move forward with. So just kind of big numbers. So the revenues that we're looking at are about 15.7 million this year, with our expenditures right at 17.5. So you'll notice that that is a change in our fund balance of a negative 1.8 million. So we're gonna go through that in a little bit greater detail, and I'll kind of explain what that all means. So I don't know if you remember a couple of months ago, I think I don't think it was last month. I think it was the end of the second quarter when that was presented. Jessica talked through the fact that it's okay to bring a negative budget forward as long as you have money in the savings account or money in the bank to make up for that loss, which we do. So we're looking at beginning 2026 with about $13.6 million in the bank. Adding the projected revenues of between 15.7 million. We brought a budget forward of 14.7 million, and that also has a $500,000 contingency built in there. So if we have some overage, we don't have to redo a budget to make that happen. Don't have to change any numbers. And then even with this negative amount that we are bringing forward for 2026, at the end of 2026, we're still projected to have 11.3 million in the bank. So we want to be spending some of this money that we have tucked away. So with that in mind, again, as I mentioned at the beginning, staff worked really hard to align the budget with our strategic initiatives. So for great governance, we're looking at board training. We're looking at this forensic audit that will be really in full gear, probably at the beginning of the year. More leadership training and development for staff, managers, leaders in the organization. Compliance training and better use of our compliancy software that we have right now. As far as organizational excellence, we have increased our professional development that staff has asked for. So we have increased those amounts. We are going to improve our software. So continue to do software upgrades and equipment upgrades so that our folks have state-of-the-art equipment and software to be working with. We are definitely working on increasing our external marketing so that we can share with the world how great we are and what we do and the services that we offer to the community. Again, I talked about data analysis software for data analysis to help us with better decision making as we move forward. So we're going to be investing in some software for data analysis. And innovation and quality team kicked off to launch. So that's our organizational excellence pillar there. As we move to health equity, we're looking at some staff training for health equity. Now that we have our health equity strategic plan all solidified and ready to go, it's time to really get the staff trained and up to speed there. One thing that I thought was really cool is we're looking at expanding our client assistance by providing funds for patient transport to get them to services. We have assessments and certification for bilingual staff to provide interpretation services. So that's budgeted for this year. And expanded communication efforts to, again, raise awareness of what we do and who we are. Partnerships. So we want to continue with the 3 funding partners that we had last year. We have brought additional money forward for a new partnership with Hoover School District. Assistance and incentives for community involvement and expanded efforts in the community. Obviously, as we were talking about HR1, there could be a lot more partnership opportunities coming forward as other folks maybe need some help and support in the community. But we couldn't do any of this if we didn't have great staff. And again, one of our goals is to be
Can you hold for a second? We've got some guests out in the lobby that if someone from the health district could go and engage, I think that might be helpful.
thanks.
You see, oh, I see. He's like, how do you see them? But then I'm standing with, so.
I didn't mean to stop the presentation. I think we can continue.
Okay.
I just
Thanks
didn't
for
want
catching
any
me.
guests just waiting.
So yeah, couldn't do this without our amazing staff. We want to be working again, continuing to strive to be an employer of choice in this area. We have listened and we have surveyed staff, listened, some things that they are looking for are improved salaries. So we're bringing a 4% wage increase across the board forward this year. We have increased both our money for professional development and staff training. And again, as I mentioned, improving equipment and software and helping with employee recognition. So those are also in the budget this year. So if you want, you can get some greater detail. I think we're on page 8 in the packet here. Revenue is pretty standard, so majority of our revenue comes from tax dollars. About 1 million we've budgeted this year to come from services. About 1.7 million in leases, both with leases at Mulberry and UC Health. Contributions. So those would be grants, those types of things, right at around 340,000. And then I know Jessica had a conservative number for investment income at about 440,000. So that's a conservative number there.
I'm sorry, what is contributions? What does it mean?
That's like grants, like
Any grants that come in?
Yeah.
Okay.
Mhm. Any questions on revenues, where revenue is coming? Okay, yeah, so anytime you guys have a question as we go through this, just pop it out. Staff, if you want to jump in, so we do have the staff on the meeting too. So I know Mike Lynch is here from facilities. We have Misty from HR and finance. We have Katie from compliance and Allison, right? Thank you.
So with the service revenues, when you're anticipating a projected of 1.05 million or 7% total revenues, does that take into account the different changes with Medicaid and everything that are being anticipated?
Yep.
Yeah. So this level, so we're good.
Yep, it's reimbursement. I understood what you meant.
It's been a long day.
All that sugar. Okay, so again, expenditures, there's more detail down here beginning on at the bottom of page 8. So personnel compensation, that is our biggest cost. We have 92 staff budgeted for 2026. We did have that personnel compensation includes everything from healthcare. We did have a pretty good increase in our healthcare costs this year, so it's that is reflected in here. Professional development, again, we did increase that based on feedback from staff, and we have some very detailed trainings that have been outlined and asked for. So happy to share any of that information if you have some specific questions. Contracted services at about 1.6 million. So we did have some questions about that. So I'll have some greater detail on that in another slide, but I just did want to point out that contracted services does include legal, does include our audit and this additional forensic audit that we have, temporary help. So and then any consultants that we use. And if you look at the history, the 2-year history of contracted services, if you look at 2024, there were like $2.5 million budgeted for contracted services. In 24, it went down a little bit last year, about 1.5. So right about where we were, right about what we budgeted for 2026 as well, a little bit, just a little bit higher. So our service delivery, looking at about 830,000. Partnership funding, we put in 1.5 million, and again, this includes a potential new partnership with Peter School Districts. supplies, equipment and software.
With the contracted services, does that include like the Angela Hayrouse group continued?
Contracted services,
contract?
yes, that's
Okay.
correct. Uh, occupancy and other expenses, 1.6 million, and capital rented about 461,000. So I'm gonna pause, let you guys look through the numbers and see if anybody has any specific questions.
Are we gonna have a time that we talk specifically about partnership funding? Or is this now the time?
Yeah, I think you can pop in anytime with a question.
I'm just curious with the PSD partnership, what specifically is that funding?
great
And
question.
what are the outcomes that we would anticipate from that resource?
I think Allison wants to talk through that. Okay.
So, that partnership, those dollars are. PSD lost significant grant funding. And it was for a collaboration with PSD to help social justice and short student embedded in the school system. They're gonna drop off the funding list at the end of the year. So
That's at the end of the calendar year, not fiscal year, right?
yeah, so this funding is really for that to continue those students through that next and the rest of that full academic year. Because otherwise they have students that are counting on this money to fund their education, and so that's our attempt to help them bridge that gap until I think they have 2 years left. So they're continuing to look at options for the remaining dollars lost. I'm adjacent to this partnership, so I'm not going to very well often, but that's what it's for. Do you know about that partnership?
I do. I guess like what I'm a little bit so I mean, certainly we're supplanting for them, in other words, because we're able to provide bridge dollars per se. But this initiative has been multi-year, and I think that they've just been in their second or third year out of a 5-year grant cycle.
Yeah.
And so these dollars that you're talking about, which is roughly what, about 400,000, is only getting them through the rest of the semester. And so what then? Because if it's a partnership, it's a partnership. So it feels like it feels like this is a little bit different than partnership funding, because partnership funding is ongoing embedded programming that is for the year versus this, what we're talking about is really bridge dollars that's really getting them through, which is commendable. I'm not opposed to it. I'm just wondering then what then, because I think the climate is not going to get better necessarily fiscally, and the services and the needs and the partnership that the health district has created, referral process with PSD and with Summit Stone, I think has been commendable and celebrated throughout this community. So I'm just curious, essentially, why only this much, or what is the intention, and what does then partnership actually look like?
From what I know.
Yeah.
Presentations that I've had involved. I think what we're trying to do is have enough time to figure out. I mean, I think we would certainly be interested in potential partners, but we don't know for sure what they're going to get. They're tapping into a lot of pieces. And so I think that this is designed to figure to take that pressure off immediately and empower more. There's also there's a whole bunch of additional potential with this for the student piece as well. So I think this partnership could look different moving forward. The funding and trying to help create that pipeline for students, which is a lot of work to do. I think figuring out what they're That's what they indicated they needed right now.
So we did, we have that $500,000 contingency in the budget, thinking that we may need that to get us through the fall semester. Obviously, then we would rebudget again for 2027 if it was something that we're gonna continue with. This grant does go through 2027, so that would be the end of it there, but we have space in there if they need funding in the future, the fall of 2026.
Six.
I can add something. Apparently Allison can hear parts of what you're asking, but she cannot respond. So, part of the other thing she wanted me to let you know is that, we're looking at working with PSD and others to look at workforce pipelining through the behavioral health system, because is looking at that as well, and how we can work collectively on training and supervision across settings. So that's that secondary piece that I'm talking about. I'm gonna ask her to give just a little bit more context about why only the one semester, so that. Are you doing?
So I'll pivot to a separate aspect of partnership funding. How do people qualify to be able to be identified as a partner in order to be able to be considered for funding? Is there an open application? There's lots of nonprofits and organizations throughout Northern Colorado right now that are facing financial challenges. And so how do we do it in a transparent way that is aligned with our services and the work that we have? And
That's
so
a great question. We don't have those established yet, but we did just hire a senior partner strategist starting shortly, early November. And that will be part of the role of her role to establish those metrics and guidelines.
Okay,
Yeah.
thanks.
So, that is a lot of the work that will be happening this year, because that's extremely important to set it up so it's equitable, and it's not just the partners that we always work with. You know, we have to have a process that is fair and equitable and known, and there's processes involved, and so that strategist that was just hired is gonna, I know that that's their first order of business.
Awesome.
So I think your question spot on.
Well, and I think I guess my intention isn't to question the partnerships that we are already in existence. They're strong. And we know that there's evidence out there of effectiveness and real impact. However, I do think that the health district can play a really critical role in being able to provide resources and support for real vulnerable communities and identities throughout Northern Colorado and the organizations that serve them. And so I would like to, at some point, I would like to hear about how that is being organized, systematized, like how do people would apply for something? I mean, I was hoping maybe the 500,000 discretionary would be for some sort of bank of applications that when we see real need moving through this next fiscal year or calendar year, what that is going to mean for the different organizations and how they would be able to partner with the health district differently, knowing that community engagement is also an aspect that the health district is trying to increase and enhance.
Yeah.
So.
Excellent.
I do have some trouble, like, especially with me on this, but I just found that I can, talk on or all that too, if you want to.
More than anything, I just wondered. I mean, I know the grant in PSD well enough to know that amount isn't going to cover the full year, and so what are we obligating ourselves to? What are the outcomes? What are the impacts? And how is this going to be a sustained effort or sustained partnership? So just all of those things that it would be great to have a little bit of process or transparency in how some of those decisions and things are being made. Yeah. And as I said, the work is really important and it's making significant impacts.
Related to that is defining the needs in the community. And when are we going to hear the CHI results? Is that
I think November,
Soon?
soon,
So,
yeah.
yeah, that'll be interesting, and I've also thought, and there's no rush about this, but it would be good to identify whether they put an invitation out, so it isn't so identified of potential partners in the community that want to talk to us about what they're seeing as communities. Because we're sitting on a lot of money. And there's gonna be, their needs now, they're gonna be huge in a year. Because we're gonna be in year two, you know what? And it's not gonna be pretty, so. I think we have to keep our eye on what are the needs of the community that aren't being met, that we can help with. We have the
Agreed.
capacity to help.
And having a systemic way in which organizations who are out there with the
And how you
program
do
can
it.
apply and
And how you do
approach. Mhm.
Right.
So would you be comfortable then, changing this number, the $500 contingency, and making that higher for 2026?
Since you've got so much in reserves, I think we can always, a budget is meant to be a living document.
Right.
It's not gonna lock us in. I wouldn't worry about it. You wanna worry about it, go ahead.
Well, I do think
Yeah.
part of what we're doing here is stating what our intentions are, and I mean, the budget is our promise to the community of how we see our priorities. And so I think that's what we're doing.
Yeah.
Both in terms of, this funding through the spring of 26 for PSD, but also with the recognition that that ain't gonna be enough, right? And so what we are doing, I think, tonight is assessing that, as Courtney said. Do we want more in there or not? I don't know that, certainly not, we're not making the decision tonight, we're just discussing it. But I do think that what it sounds like from my colleagues on the board is that there is an interest in making sure that we are when we enter into partnerships, that we are doing what we can to maintain those partnerships at the level that we intend, in terms of the promise that we are making to the community, that this is a priority, that this is something that we are putting our funds behind, our community's funds behind, and we find to be in the public interest and the best use of the public taxpayer funds. I think, as Lee said, having the reserves, I think, helps us to be able to do maybe a mid-year assessment if we need to do that once we see where PSD is at, and we'll have a better sense of that. But I am hearing, and I concur, that what we're looking at is a promise to the community to be there with our partners and for our partners when we make those commitments to them. And that we do so in a way that is realistic and manageable, but recognizes that there are other demands in the community and that we need to balance those out.
Yeah, I will say, I mean, you were speaking about students and the cycle they're in, and like not long after we pass this budget, I'm sure CSU is going to be, going through their process of recruiting the next cohort for, that's gonna start when they start. So, yeah, they probably, it would be helpful for us to, I'm sure you are in conversation with them, but I mean, they're gonna be right in their next cycle and not long.
Yes. We are talking, we talk to them a lot, and they're amazing partners already, so I don't think we have any intention of a one and done, but we just don't know the next step yet.
That's fair enough.
So I think that's where we're at, but we do think that we surround those conversations. Understand what it looks like and what exactly gets to you.
I will say, I super appreciate the workforce development aspect of this. I think that's our collaborating with others in the community in Northern Colorado around that is only going to make our region stronger. So I'm pleased to hear that.
And I would like to know, with these sustained efforts, if with these dollars associated, what schools we're specifically in and supporting. Knowing that we have an obligation to be supporting some of our most vulnerable populations. And I want to make sure that the resources are going into those communities.
So, Allison did share some information in case she had some technical difficulties. So, I don't know how many schools are in the school district, but it's 22 schools, elementary through high school. Is that?
Wow, that's great.
Yeah.
There's 50 schools.
Okay. She said 11,507 documented student contacts in 2024 and 2025. With nearly 1,200 students. 26% of the resources were provided connected students and families to community supports through kayak. And this loss comes at a critical time when youth mental health needs remain elevated, which we all are aware.
23 schools, I don't know which one.
Okay. Yeah, I mean, just to be explicitly clear, I wonder about our Title I schools that are at a federal level are already losing dollars.
Yeah.
And so want to make sure that they're supporting our highest impacted elementary, middle and high schools. And so there's certainly there's rank orders, there's all sorts of stuff that you can look at that those areas of need. And so how do we align? What I'm trying to understand is how are we aligning our resources with the needs?
Yeah.
Because these aren't new needs. We know that they've existed. They've existed before the pandemic, during the pandemic, and now post-pandemic. And so it shouldn't be, I don't want to be misaligned in that. As we are an organization that believes in equity and we are believing in, I guess, the whole purpose of the health district is to really provide and attend to the social determinants of health. So I would want to make sure that that was explicit.
Yes.
But I guess I'm still wondering about like, we're coming up with ideas, right? We're not voting on anything
Correct.
tonight. So I'm just curious about what ongoing support, what discretionary dollars need to look like. Certainly, I don't want to be just like, here's discretionary dollars without some guardrails, because I think we do need to be accountable and transparent about what that really means. But I do think that if we're really in it for partnership, then let's be explicit about that. And I would expect any partner to continue to go out and seek resources and additional partnerships so that we're not the sole bearers of that. Thank you.
Okay. Okay, any other questions? On the proposed expenditures? Okay. So, again, biggest portion of the budget here is compensation. We did include a 4% cost of living raise for staff. Budgeted for just around 92.5 employees for 2026. As I mentioned, we did get a big increase in health insurance this year. Started out at 17%. We ended up making some changes to our plans. We're about 10% increase in insurance. So,
That's a question about that. What percentage is offset or carried on to the employee versus the organization absorbing that?
yeah, 0. We cover for the employee, we cover 100% of the premium.
Okay.
And for families, we cover 75%.
Well, okay. I guess maybe answer it. Maybe I didn't ask it the right way.
Okay.
So, we saw and how much percent increase in our health benefits insurance?
10.
About 10. And so, did that 10%, was that, I guess, with any increase to employees, or did the organization?
We did have, depending on the plan, there are some changes to deductibles, and there also one that I think it went from like a $15 co-pay to a $25 co-pay. So
Okay.
they weren't huge. There is one plan that had a pretty significant change in to the deductible, but people are able to choose a different plan.
Okay. And the only reason I'm wondering is from a total rewards package, we think about a 4% COLA, but then, if the organization absorbs all of the increase to benefits, then it's actually a better total rewards package as opposed to you give 4%, but your benefits increase and you have to pay an additional 10%, then it's actually not 4%, then it's actually like a 2.8% increase or something. So just trying to understand what the total rewards look like.
Question.
Well, and I had a question about the 4% COLA because my guess is that that is going to be in this climate on the more generous side.
That's what was actually recommended to us by CPS.
Mhm.
They brought that forward for us this year.
So CPS did? What,
I'm
what's?
sorry, CVIS did.
Oh, okay.
Yeah, I was like.
I would say even though
Which
they
means
might,
that-
while they might recommend that, I still agree with Julie. I think that that's on the more generous side. If you look at what CSU did, if you look
Yeah.
at what the city did, if you look at other organizations and nonprofits that did
Yeah, it's
no
1, 2%,
no raises, 4%
0.
is really big.
Were they taking into account just where baseline was? And so it
So,
was making.
so
up-
baseline
Huh.
moved. From a hiring standpoint, is that what you're asking? That moved, they recommended 2% there and then 4% for staff, for current staff.
And was it that we were kind of under as far as salaries go and wages were, there was some making up to be done?
Yeah,
or
I think
where-
there was an adjustment 2 years ago. And then we
Yeah,
had a
I
little
think that was all
compression and
done,
then-
right? Yeah.
Yeah,
So now, yeah.
And so common practice, when you look at market adjustments and you go out to market, would be looking at that every 2 years
Mhm.
as opposed to every year.
So it wasn't as if there hadn't been adequate adjustments previously, so we were needing to make up for being behind necessarily. Okay.
Yeah, so that's what we did 2 years ago, was
Okay.
we had a big study and they, mapped it all out. And there were also did some mapping as far as the levels and, where
Mhm.
people were in the system. And so we made a big
Just pretty
adjustment
fine tuned then.
2 years ago.
Okay.
Yeah. So CBES is recommending 4%. What's their rationale for that?
they did a survey study for the area.
Okay.
Yep.
Because we've definitely had inflation, but as my colleagues have mentioned, there's spending freezes and things like that in some other places, so.
Misty, anything that you want to add?
So right now you're saying there are 28 vacant positions?
So, yeah, if you remember, I addressed this a couple of months ago because we had with the budget of 2025, we had the shared staffing positions still in there, so those just weren't going to be filled for the whole year. So they're vacant now because they were budgeted at the beginning of the year, so that number is in there, but we don't have them anymore.
Because it was budgeted.
Current positions, because we had to budget them for the first 6 months of the year. So it's a little wonky looking. Don't have the 30 open positions. Yeah.
Yeah, so I've unmuted. I will say that last year, organizations around us gave a higher increase. And the actual increase recommendation from CBIZ was a 2.6 adjustment to the salary structure and a 4% salary increase budget. So that's where we settled on the 4% rather than 6.6%. Based on what I had heard from local HR leaders across the community. I will say that the county is doing a higher, they're doing around 4% because they're doing some adjustments to their structure as well. So for some people, it'll be 2.8%. For others, it'll be 4%, according to Bridget at the county. So hopefully that's helpful.
It is helpful to have that extra context.
I guess in the future, I'd also like us to look at what the hospital and healthcare compensation service looks like. They have an annual report that they print, specifically the behavioral health salary and benefits report. And so you're able to look at that nationwide. We'd be in Region 8, which is a cluster of states around us, and you're able to see all levels of different compensation and the increases that they provide, look at the market. And so I think that that's a really good report to look at, to be able to see some regional context as well as then looking at some of local data as well.
What was the name of that?
I can send it to you.
Okay, that'd be
Yeah.
great, thanks. Any other questions here? Okay, so again, had some questions about contracted services, so I have this broken out by each department and what was requested there. And we have everybody here, whether they're in the room here or on video, if you have some specific questions about their contracted dollars and what that looks like, we're happy to answer any of those for you tonight.
The client experience category, is that how you track? It's sort of a survey of the client.
Client experience is all of our direct service programs.
But this is under isn't this under contracted?
Well, this is all contracted services, so we have it broken down here by department if you had some specific questions, so. Yeah,
Thanks.
yeah.
But I understand your question as far
What,
as.
what is like kayak of having a contracted service of 144,000?
Those are the questions, so.
Yeah, so we have, we're doing Northwood Open Minds, who's gonna be presenting next month. They're really. They're evaluating our services for us to benchmark that to best practices, give us a roadmap of, compliance and, just best practices up to date of how we should align with that. And we would like to do some more work with that this coming year, specific to potentially exploring a collaborative model of psychiatric services that is more expansive than what we've been able to do. That's evidence-based and compliant, and so we charge somebody to do that with them.
So under executive team, $200,000 in contracts. What did
So
that?
that's, we have a big project that we want to undertake from moving all of our files that are currently stored on drives. We want to relocate those out to either a SharePoint or a Teams location. So we want to contract those services out. Also going to contract more service or work with the culture journey as we're going through 2026 strategic planning.
Thank you.
Yep.
5,000 for interpretation services seems really low. If we're
I
doing
think there's a
the,
class that has already been kind of vetted.
Is that?
I mean,
that's
the
for
interpretation services, those are two different
Or
things,
that's-
right? Yeah.
I don't know which.
It's, yeah.
Yeah.
The interpretation services, so that's the company that we're already using
Yeah,
and contracting with.
What, and that doesn't live under me anymore, but what I think that is for, hearing impaired and transition services that we need, but we don't have a big expense with that because we have a lot of bilingual staff. And I think that's why it went into those, so I think that was just.
Other
probably-
languages.
Katie has her hand raised. I don't know if it's in
Other
response
languages.
to that.
Yeah, sorry. Sorry, I couldn't hear Dana when she was talking, but interpretation services falls under the compliance budget now. And so what I did is I went through, we used 3 different companies and I added up what we used in 2025 so far, plus a little more, and that was the cost of it. So that was how I got that number.
Do you think it's going to be higher, Katie, in 26 than it was in 24?
I mean, it could be, but that was my kind of like higher estimate. We really didn't use the three companies I looked at. I think we're all a little under $1,000 or around there. So if we use a different company or do different things, it certainly could be.
Historically, it's been a low spend, just given the fact that we have providers that are bilingual. We do have to use the language line occasionally for more obscure languages or just that we don't run into as much, but it just hasn't been a large expense for us in the past. And imagine if you just don't put these on social setting. We do have some initiatives to adjacent to figure out some testing and some certification for our currently bilingual staff so that we can elevate that more on a, in terms of quality and ensuring that we're providing enough services. So that's it's in a separate area that we're also.
What area is that in?
I think that's under my under client experience budget dollars.
I'd be interested to learn more about that.
Yeah.
And then if they get to a certain certification level, what additional compensation are they able to receive at
Yeah,
that?
that's the work we have to do with HR. So this is geared towards helping us figure out what that looks like, building that in, working with HR. So if we don't have all the answers, but that's what we would want.
And I'll certainly be looking for something that's more stipend based and not percent, because that creates greater inequity based off of where you'll fall on your salary schedule. So one of the questions I have is, what does community engagement use for 44,000?
Well, I'm not exactly sure how this was broken out. Today was kind of the first day I've seen it broken out like this. Morgan, do you have any?
Yes, so the community engagement, that is where, the very beginning. So outreach and education, so, community engagement, although that should be really should be under client experience, because I believe this is for Larimer Health Connect and how we were going to increase. Yeah, the Mental Health and Substance Use Alliance.
Yeah, so community engagement for working is mainly for the implementation of the Mental Health and Substance Use Alliance strategy. Yeah, I had some thought, but
I was just wondering, I'm thinking about compliance and also election stuff, and so I didn't know if there was anything that we should know as far as those two things go.
So compliance, yeah, go ahead, Katie.
Sorry, I give you a break, Courtney. The any election stuff was put under the board of directors, that 25,000, and that's anticipated for anything we might need, like if we hire a DEO again, or are reserving polling locations or anything like that. It's likely near the end of 2026. And so all that was rolled up into that 25,000 for the board of directors. And Courtney, I don't know if you had anything in addition to that.
Nope. You got it. Thank you.
Okay.
I appreciate you breaking it down like this, by
Yeah.
the way.
It's very good. Thank you.
Good, thank you. All right, any other questions? Move on. So service expenses, looking to add another $200,000 here. So increased commitment to service delivery, and this would be, I'm trying to think, let me point out. this is where we're having a big increase in community advertising. So I kick that off a little bit. Also, this would be rolling up things like the transportation waivers that we were looking for, including this year, so. Big increase, we're looking again for client assistance. Thinking that we're gonna need a little, some extra funding this year, as we have more people in need.
And I don't know if this is what you just said, because I was furiously taking notes, but we did put extra money in there for transportation. That was just like, okay.
So what's the difference between client assistance and community assistance?
Yeah, that's a new split this year.
Mhm.
So client assistance is, I think it's directly for our clients, and community assistance is like gift cards, and incentives for, surveys and things like that.
I see, okay.
People that help with mental health and MHSU with those, with the Alliance.
Sure, sure.
And can you speak to client debt forgiveness? It looks like that's going down quite a bit.
I actually can't.
Because I don't
Yeah.
know what debt forgiveness, is that asset or
Is that write-offs, just writing off people that can't pay?
it's, it may.
I believe that is the write-off of some dental, built up dental, sorry, money owed from dental patients
Right.
that has not been collected based on a meeting we had earlier today. But I'm not confident, so that's just my best guess.
I guess I would just want to hear more about that projection. Is it because because now we're getting reimbursed from Medicaid that we're expecting less bad debt, or so I'd just be curious to hear more of why that number's
Yeah.
proposed to go down.
That's a great,
I mean, that's good. I think it, it's like the way she's really.
Recategorizing.
yes, and how we're.
Yeah,
redoing the
I think
whole-
that's right.
Redoing the whole
Okay,
Denver
Yeah.
billable situation
Yeah,
there.
I think that's right.
Yeah,
okay,
I can get some more information
Okay.
for you, and I'll share that with everyone, but
Mhm.
yeah. Yeah. We've done a lot this year with redoing
sure,
Detrick
sure,
and
sure.
how it's been structured, so. Any other questions? Okay, so we've talked about this quite a bit already, so partnership funding, with the addition of the one semester of the PSD funding. Anything else we wanna talk through on this, or did we cover?
And are those numbers remaining rather constant, or?
Yep. They are.
Okay.
So capital expenditures, if you all remember, we're upgrading the operatories a couple, at a time. So this year we're gonna do 3, next year we'll do 2. Software, we are working, continue to optimize NetSuite, looking at some practice management software, and some statistical analysis software. I know with our new branding, we're looking at some building signage and some new awnings on the 202 building, the and 120. Thank you. HVAC needs to be updated at 220. Some sidewalks and some curbs that need to be fixed around the campus here. The HVAC at Mulberry is, I think, 30 years old, so we're looking at replacing that. Also painting the exterior and the resurfacing the parking lot. Questions, concerns?
It's so great that we have a capital improvement
Isn't it
plan.
great? It is awesome. Okay. So, the fund balance and contingency, we do have 407,000 reserved for Tabor. About $6 million in assigned funds that are 4 months of operating expenses. Our $1.3 million in capital reserves, 1.3 million in capital reserves, and then that leaves us with about 4.6 million in unassigned funds for the year.
I do have one quick question, that kind of takes us back to the capital improvement. I apologize. There's going to be a reworking of space here on this campus for behavioral health? I was reading in the packet. That make a family.
We're thinking of doing that right now.
Okay, is that included in the budget?
It's this year.
This year's budget.
Oh, it's already been included. Okay, so that's been, okay, gotcha.
Yep.
All right, so that's already taken care of. Okay, wonderful. Thank you. And what's the time course on that?
By the end of the year.
Oh, nice. Okay, I'm excited to see it.
It depends on, I'm not sure of Mike thought, but getting the contractors all right. He's pretty good at getting.
That's nice. That's impressive.
Yeah.
Okay, well, I wasn't sure time course wise, so thank you for clarifying that.
Mike, I saw your name pop up. Did you have something you wanted to share? If so, you're on mute, it looks like. If not, what's that?
It's left.
Okay. Okay, okay. All right. So just a little review, next steps, the budget study session today. We'll move forward with the budget hearing November 19th and then budget adoption at December 10th.
Question.
Yeah.
I'm just curious, we contracted with someone to help with our strategic plan this year.
Mhm.
And as well as board orientation pieces. Is that still in the budget, or will we have a chance to be able to weigh in on that cadence and how much we really want to commit to that process and how we want to engage in that process?
So as far as the strategic plan refresh for next year, I don't know that we'll need a facilitator to the magnitude that we had this year, since you guys are kind of left. And it's again refreshing. We will need for 2027 because we'll be moving into a new plan the following year. But as far as the board trainings, we have two more contracted trainings with the Lynn Group, one in February, one in November, and the following in February. So we will have there's a little budgeted money for the February training, and then the rest is open discussion.
Okay, so that's not in the
Yeah.
budget currently, though,
There's
besides the
there
February.
there is a little bit of money in there for trainings that you guys would be interested in. So,
Thank you.
I was looking at the capital expenditures, and I don't know if Mike is still on or not, but one of the things that I would like us to look at next year, it doesn't have to be this year, as a board, is the continued viability of maintaining Mulberry. So I would like to see that
Okay.
be something that the board takes up in 2026.
Just so I'm clear, an analysis of whether we maintain that or not. Is that
Yep.
what I'm hearing? Okay.
Absolutely,
Okay.
because I mean, we're looking at right here, 130,000.
Yeah.
140,000. It doesn't look like our income is that much. Not sure we need the space. So I know in prior information that I've received, that we've received as a board, is that I'm not sure that's the best and highest use of public funds for us to be maintaining that. So I would like that to be, speaking as a board member, speaking as the treasurer, who's looking out for the public nut. I would like us to take a look at that.
okay, thank you.
Does that have any, I mean, How does that relate to what we're approving here, though, too?
We're not
Because-
approving anything
Right.
right now.
guess,
I
right.
just am flagging that as
Okay.
an issue because it came to my
There are
attention.
substantial dollars here.
There are substantial dollars, and when we look at the rent income that we're receiving, I don't see the offset, and I'm not sure that we need the space, given the reorganization, the relocation that's been done, and the other improvements that we're doing right here. So I want us to, I think it is beholden to us as keepers of substantial public funds, particularly at this time in our society, in our world, in our financial situation that we're finding ourselves in, not just in Larimer County, but in Colorado and across the country, for us to really take a hard look at that. And Mike, you pop back on. I don't know if you have anything you want to weigh in. And it's just a request. It's obviously not something, it just, I was alerted in the context of the budget discussion that this is a conversation we should be having.
Yep. Go
And Mike, yep,
ahead, Mike.
Hi, can you guys hear me?
yes,
Yeah.
loud and
Hey,
clear.
great. Hey, it's my first time to be able to speak tonight. Thank you guys so much for everything I've been able to hear tonight. Julie, to your point, yes, all of our programs have moved out of Mulberry, so it is a great time to kind of look at.
Oh, we lost you for a second, Mike. We- You're going in and out a bit.
So, can you, on the lease revenues, we've got 1.66 million in there. What's the lease revenues from Mulberry?
Let me see if I have that broken down.
Do we own that?
Hmm?
Do we own that?
Yes,
I thought we did.
yeah, but it also
This is-
has a lot of
This is bubbled up
infrastructure.
at other times too, so I think.
Yeah,
this-
there's a lot
it
of
warrants
infrastructure.
So we've got $127,000 budgeted for tenant lease revenue in 2026.
So
So
it looks like we lost Mike.
45.
Yeah.
So I don't know that it is appropriate for us as a government agency and organization that stewards tax dollars to be landlords. And that's what we are now.
Mm.
So I'm just, again, not asking for any further conversation, just put a pin in it.
No,
Thanks.
Yep.
the
If
walls-
you guys can hear me,
Yes.
Hello?
Mike. Yeah.
hi, sorry about that. A little glitch. Julie, I do agree with you. Now that our programs have moved out of there, I think it is time to reevaluate that billion.
And then there's the question of, are we gonna assume we're never gonna add any more services?
Well, okay, we're not gonna get into it now, but
No, I'm not meant to. As we get into this discussion, that'll be one of the points we'll be discussing.
If additional space would be needed.
It is a space that we're using as in a partnership agreement now too with the higher center. So, yeah, I think it's good to look at it. Okay. Any other questions?
You have more questions about capital expenditures?
Do I?
Yeah.
Nope. That was, as long as we're looking at that 145 there, I want to know what was the lease revenues on that. Okay, if we don't have any more discussion, then I will just look out at our one. Looking at you, or online, if we have anyone else interested in public comment at this time.
I would love to make public comment.
So if you wouldn't mind, so there's, and in the first packet, it says there are guidelines for making public comment.
just go ahead and read them again, Erin.
Okay.
Yeah.
The Health District of Northern Larimer County Board welcomes and invites comments from the public. Public comments or input are taken only during the time on the agenda listed as public comment. And it is an opportunity for people to discuss their views, and therefore the Board of Directors generally does not engage in back and forth discussion or respond to questions. And so what I was trying to say is if you choose to comment, please follow the guidelines for public comment provided at the end of the agenda. And so if you would like to, we'd need you to identify yourself, clearly spell your name, tell us whether you are addressing an agenda item or another topic. And address your comments to the Board of Directors rather than to any individuals. Okay, and if you could go to the
do it
podium,
from the
please.
microphone.
Yeah,
Thanks.
since we're recording, it'll pick your voice up better.
Thank you.
Thank you.
My name is Meredith Graham. Meredith. Graham, just like the cracker, Graham. And I just have a couple comments. First, the Colorado Nonprofit Association just released their salary comp report. So that's something that they do regularly. So that's another good resource, I think, that's maybe not relevant for this year, but will be in the future. And I really appreciate the discussion around setting metrics around partnerships and being more transparent about how much money there is there and who's going to and why. And I guess my suggestion, my thought is it's such a wonderful position to be able to give money out instead of just constantly being asking for money. So I think John made a comment about how valuable it would be that partners were going out and trying to find other sources of partner money. I think the district has the potential to be more involved in that, especially if you're going to be dipping into cash reserves to say the district is going to provide X percentage of the necessary funding as long as there's another organization that can come on board and help, or some way to use the district's contribution to leverage additional money from other sources. So I know like the Betcher Foundation, they stepped in, my last organization, I think the last minute was $30,000 grant that opened up $500,000 in funds from the Office of Economic Development and International Trade. So, and they love coming in as sort of the like last minute savior. So that's on public record. Just thinking about ways, I know that kind of just it adds to the strategy and impact team, or it adds to the workload of the district, but I think not wanting to write that really big check yourself. It would be great to see other people brought on as a matter of course of practice, as opposed to just writing all those checks yourself. So thank you so much. This has been a thing.
Thank you for your time.
Yeah.
Coming.
And we don't have anyone online, right?
No.
Oh, okay. All right. So do I have a motion to adjourn this budget study session?
So moved.
Second.
All those in favor say aye.
Aye.
All right.
Any opposed? That passes unanimously. Thanks all for a great meeting.
Thank you.
Thank you, guys.